Ghana has confirmed 5 cases of monkeypox. The development has put the country's health authorities on a high alert. This was confirmed from samples collected from 12 suspected cases in 5 regions. Though the first cluster of the rare infection was detected in the United Kingdom, monkeypox is fast spreading in Nigeria, Cameroon, and other West African countries, the latest being Ghana. Now listen to the Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje, as he announced this at a press briefing a short while ago.
So how Omicron just rose in a week, and it's the dominant variant is still the Omicron. Okay. So we want to thank all our partners for their support, especially the media and all our partners, health partners, the Ministry of Information, for the wonderful opportunity they create for us to educate the population. Thank you very much.
All right, so that was the Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaje, giving us a brief on the latest development in terms of Ghana recording its first cases of monkeypox. This has been in the system for some time. We all dreaded it coming to the country. Some 2 weeks ago, there were some reported cases of Ghana recording its first case, but that was brushed aside by health officials. Today, we are hearing this very news that Ghana has indeed recorded a first case from some samples taken. Manuel was at the press conference and joins me in the studio with Manuel. Which areas are these monkeypox cases recorded, and how do they manifest?
Well, indeed, according to the Ghana Health Service, a total of 12 samples were collected on 24th of May, 2022. And out of these 12 samples, 5 of them were confirmed here in the Greater Accra region, in the Western region, and in the Eastern region. And so we currently have these 5 cases spread across these 3 regions. We're told that the Ghana Health Service has stepped up its surveillance, as it were, to be able to track, any suspected case. And indeed, what we're told by Dr. Patrick Kumar-Boaje, who is the Director General of the Ghana Health Service, is that contact tracing of these 5 infected persons, who include a Ghanaian who just had returned from the United States of America for a short trip. Contact tracing has begun to find the contacts of these persons and possibly bring them into some sort of medical supervision. What you'd need to know about the monkeypox, even before its manifestation, is that it currently does not have any known treatment. Yes, there's a vaccine which is in limited supply across some parts of the world, but Ghana is currently not in possession of vaccines,
a single dose
of monkeypox. And we understand, according to the Ghana Health Service, that the infection at its current rate is not at a level where the country would want to go in for vaccines, especially because the vaccines themselves are in short supply. And so then we can talk about the manifestation of this particular infection. So the most common ones, as we have seen, rashes and some sorts of bumps on the skin lesion, and you'd have fever, and all of these ones seem to be quite prevalent in the cases that we are seeing. Fortunately for us here in Ghana, the cases are not as violent, if you like, as deadly, because we've not recorded any death just yet, and they are quite mild, according to the Ghana Health Service.
Were we told the transmission mode, such that if there is anything we can do to prevent the spread, then we can all contribute?
Well, definitely. The monkeypox itself is a zoonotic disease, which means that it's transmitted from animals to human beings. And so you'd want to, just for the sake of the current situation, stay off animals, rodents, your pets, and so on and so forth. As much as possible, you want to stay off them, and then avoid touching people, their faces, on their skin, and so on and so forth, just so that if they're carrying the monkeypox, it does not get transmitted to you. And so these are the sort of manifestations, and indeed how you can prevent yourself from contracting the monkeypox.
All right. So that's that on monkeypox. Did they give us any update on what they are doing to ensure they halt the spread?
So currently, as you just said, the Ghana Health Service has stepped up its surveillance to be able to zero in on possible cases and trace them, and also put the people on medical supervision. I've already said that it doesn't have a known treatment just yet, so you rather treat the symptoms in fever, in a rash, and so on and so forth. However, as we were seeing, and with the health space, it's almost as though we're facing a triple threat here in Ghana, with monkeypox, the latest, to join what we've already seen the past couple of weeks in influenza and COVID-19. And so that's the situation that you have.
The Director General also gave us update on COVID. What's the reading of the situation now in terms of COVID-19?
Well, the Ghana Health Service admits that there's currently a spike. From an average of 1.3 cases daily, somewhere in April, in the Greater Accra region, we are currently doing 44 cases daily. And so that's what you have here. And if that, trajectory, as it were, continues, then we may have quite a situation on our hands. They've been quite heavy on people wearing their face masks, because per the data that is available to the Ghana Health Service that we've seen, a lot of these cases that are being confirmed are coming through, enclosed spaces, in schools, in workplaces, in churches, and so on and so forth. And so they are encouraging that people wear face masks where they go into enclosed spaces.
All right. So that's my colleague Mano there. Now, the minority in Parliament is threatening to block the introduction of any bill by the executive should the chairman of the Constitutional and Legal Affairs Committee, Kwame Ayimedu, continue to delay the passage of the anti-LGBTQ plus bill. His comment comes after the justified delay of the bill, arguing his committee will not cede to pressures from the minority to do a shoddy job. He insisted that the committee will go through the legal processes before the passage of the bill. But in a sharp response, the Minority Chief Whip, Muntaka Mubarak, argued that the chairman ought to have used the right channel for the passage of the bill. We'll bring you more details on the particular story right after the break. Stay on.